While you're doing that, at least say hello. I'll turn my video on for a little bit so you can see me for a moment before I shut it off. There we go.
We're good. So welcome, everybody. This is MS Office Hours. I have my wonderful co-host.
Heather Cox is here.
You would think you'd pick up quicker on that, Heather. We've done that now for like 8 weeks. My name's David Perlman, Director for Education Solutions. Today is June 18th, and with us today we have Srini from our Health and Life Sciences group, who will be talking about virtual visits. And these can be used for any number of things. So Srini is one of our worldwide leads, and I'll give it over to you for the next 20 odd minutes, and we'll leave some time for some Q&A at the end. Alrighty, thanks, Srini.
Yep, I'll keep it pretty short to open it up for a Q&A. So let me share my screen real quick. And just for bandwidth purposes, I'll turn off video while I do screen share. So if you have any issues. Undo video. All right, good deal. I'm going to skip over some of this stuff because it's just motherhood and apple pie about Teams. You guys know this stuff in and out. I will spend a bit of time on this because we've used this diagram and this talk track with a lot of healthcare providers, because when you talk to the med centers that are part of EDU, many of them don't know what Teams is or Office is. In fact, most doctors think of, what do you think about Microsoft Office? Their normal answer is, I hate email, because that's what they've always ever known. And so to change that perception and really cast Teams as a platform that's extensible, we try to really show Teams bringing together all of the other capabilities of Office, built on that secure, compliant foundation and graph accessible, but also bringing together Azure Insights and Dynamics all into the same canvas. So this has been really helpful for us to talk about Teams in this context as, from the ground up built as a cloud communications platform, but now as a platform that brings all of the other pieces together for you to coordinate your work and to bring clinical insights, bring medical insights, bring dashboards that are relevant to your hospital all together into the same canvas. So we start with that. I'll skip over again some of this because this is just all normal stuff. But I'll get to this slide. So when we started down this path of healthcare and focusing on healthcare, there were a couple of things that we were trying to do. And primarily what we were looking at doing is taking some core capabilities of Teams like chat and thinking, what could we do to make this much more tailored to support healthcare industry workflows? So how can we do read receipts? How can we do secure image sharing? How can we drive priority notifications or multiple levels of priority? How do we handle it when a surgeon's in a surgery and he can't communicate? How do we do escalations on an urgent message? Because oftentimes if someone doesn't answer in a certain amount of time, you'd be able to do those things. So these are kind of the Lego blocks that we built out to enable a more healthcare focused chat messaging, secure messaging platform. So we did the same thing in the context of virtual visits. So we took this great meetings platform we have in Teams and all of the capabilities that come with it. And we said, what if we took this and actually used the bookings tool to now be able to schedule and book virtual visits for hospitals? What if we could take the same platform and also do third-party and LOB app integrations to things like Phreesia, which is an intake platform, or to things like Epic, which is an EMR system? What if then we could also enable this experience to be an embedded experience, which is something that's in preview right now, where you as an organization can have your app and the Teams meeting for the patient is embedded inside of your app experience. So that's been the notion, is how do we take that meetings capability, but now port it in a way that's very supporting that telehealth or clinical engagement with a patient workflow. What does this actually look like? This looks like in healthcare providers by and large. And so we've seen a huge growth in usage of Teams in healthcare providers, and that's inclusive of a lot of the med centers that are connected to educational institutions. So take SUNY, take Stony Brook, take University of South Florida, and there are hundreds of these that are now, the medical centers are now starting to use Teams. We're in deep engagements with the folks like OSU, where they have, they have 60,000 students, but they have 29,000 employees that are part of the health system. So in some of these organizations, you'll see that the Med Center is actually a very significant employer and has a lot of people that are tied to that health system. So we see them using Teams to be able to do virtual connections, clinician to clinician, for referrals, for for getting specialist insight. And now we have the ability to be able to facilitate both the scheduled context of a virtual visit and the on-demand version. So because Teams has an open meetings API, we can allow it to be scheduled via the bookings app as an example, or it can also be scheduled on demand, ad hoc, as you need it, via a bot interface. So you could have a bot triaging someone who has a mental illness or a mental concern, and then they could say, I actually want to talk to a psychiatrist, and there's a psychiatrist on call, and they could have an ad hoc virtual meeting created out of that. The other thing that we've seen is that because we have an open meetings platform, we've seen people take this and say, you know what, due to COVID, I don't want to go see patients in their room if I don't have to. So inpatient in the hospital, they're looking at using Teams in a virtual context to connect from the nurse's station or from the doctor's mobile to that patient. We've also seen organizations that have taken that and said, look, I want to enable that patient to be able to connect with their family while they're in the hospital. So we've enabled these scenarios leveraging the flexible construct of Teams. Again, this is just generic team stuff. The great thing about Teams and that where we stand out is that we bring a lot of capability that other platforms that have been used in healthcare don't, like message translation, the notion that you can do recording and transcription, and also that you can do closed captioning. The notion that we have background blur and AI technologies that can be embedded inside that platform. So what do? We allow the bookings app embedded inside of Teams to be able to bring a group of doctors together, to be able to schedule a virtual visit on behalf of them, to anonymize that virtual visit. So it's not coming from Dr. Perlman, it's actually coming from Perlman's Medical Practice LLC, right? So you can have it come from the institution's practice to be able to schedule a virtual visit with a patient. The doctor's email alias is anonymized. The patient can join that in a not needing a license in an anonymous join experience, and then they can have a very good virtual visit. We do have WebRTC on the web browser, but we do require the download of the Teams mobile app on mobile devices, Android and iOS. We are also working right now with Epic in the ability to actually be able to schedule through the Epic electronic medical record system, and then have the meeting be delivered via Teams. And so we're in a 60 to 90 day cycle of being able to enable that. So for those of you in the healthcare medical systems, most of them, if not all, are on Epic. That's the predominant EMR that most medical organizations use, except for a few. And so there they can actually use the scheduling flow inside their EMR to schedule the visit. The patient can get the visit invite inside of their MyChart application. They can join that visit, but it's a Teams meeting that's actually being delivered to orchestrate that visit. A couple other things that we've done in terms of extensibility, just for you to be aware of, because again, the Teams API is extensible, we've seen people use it. We built a little app template that you can essentially take that, create meetings as a widget, and you can place it inside of your application. We've also worked with organizations like Phreesia that do, already do the intake and scheduling for lots of organizations, and we've integrated Teams within the Phreesia capability. And we've also enabled things like that virtual rounding capability with Teams with a Power App that's a GitHub repo. So just to give you an idea of some of the areas where we're seeing Teams being used within the medical systems to be able to serve some of the really acute needs that have arisen out of the COVID crisis. So I'll just stop there and open it up for any questions or thoughts. The one other thing I wanted to add is that for organizations that are looking for a more complete telehealth workflow, we actually have a partner that has built an end-to-end kind of workflow with Teams. And I'll just share that very quickly so you can see that. What they have done is they've taken the Teams meetings experience, and they've said, hey, great, Teams has an awesome meetings experience, but let's bring in a bot and allow you to do all of the other things you need to do on that pre-visit and visit prep side, whether that's consent forms, whether that's eligibility checks, co-payments and billing. So they can integrate those components, and then also during the visit, they can bring medical record data directly into a Teams virtual visit via their bot. And then they can also manage the follow-up, post-visit education, post-visit follow-up forms and surveys and those things. So we have both capability within Teams, but then we also have partner solutions that extend that to make it a much more comprehensive capability. Thoughts, questions? Just while we're waiting for questions, just to give you a sense, we have people like the University of South Florida and Stony Brook Health have been leveraging this platform. Stony Brook Health is doing about 4,000 virtual visits a week. So we're not talking about small numbers. It's quite sizable. They're looking at 50% of all of their outpatient or ambulatory visits being driven virtually via Teams. And then University of South Florida is, I think, doing around 1,500 or 1,700 virtual visits a week.
So, hey, Srini, it's Dave. Couple quick questions. So this was in a healthcare context, right? And that's kind of what you live and breathe. Yep. If we were to change that a little bit, right? And we were to change, EMR and,
yep.
Inpatient, outpatient, what are the moving parts? What's the virtual app look like? What kind of licensing is needed for that? And so let's walk us through a scenario. And again, I don't know what level you can get to. Let's just say that we want to set up, we have a healthcare clinic on campus, and this could be counseling. It could be any number of things.
Yep.
Kind of what does that look like? What needs to be enabled? What is setup like? Those kind of things.
Yeah. So there's really nothing special about the setup. This is just standard Teams functionality. So if you have, you guys were talking about bookings before, and I was very keen to understand that because not only is there the ability to do bookings for in-person stuff, there's a very simple toggle in the bookings app that allows you to make it a virtual meeting with Teams. So as long as they're E3 licensed, they have access to the bookings, or A3 licensed, they have access to the bookings app. And then they can essentially do, let's say, remote advising. They can do remote counseling. They could do remote admissions. They could do remote recruitment. So any scenario within EDU around that, enrollment side of things, or once they're in the school, to be able to do any of their, advising on grades, advising on which major you want to choose, advising on, career paths and career directions, as well as all the way down to the other side of EDU on the alumni side of the house of curating the alumni ecosystem, doing live events for alumni, engaging the alumni in, donor discussions. Mm-hmm. All of those things could be facilitated within the Teams, within the bookings capability, within the Teams meetings.
So even, parent sessions, right, where teachers are meeting
Absolutely.
with parents. And here's a cool part that I love about Teams, Srini, is that, it doesn't necessarily require a license for the end user, right? They can get guest
That's
access. Right. If they have A1, you can still get access to all the functionality that we talked about. Most of the folks on this call are probably A3 or A5 in many cases. But again, this is stuff that's built into Teams. You get the bookings app. I think we're going to see more and more use of this as we go into the fall. So I kind of love what we've done in the healthcare scenario. From an overhead standpoint, and we'll come back to a few more of the questions. How much overhead have you found in terms of kind of setting up the virtual visits piece, Srini, with our customers?
Yeah. So I'll just walk you into my demo tenant so you can actually just see what that experience looks like and how hard is it to set up. But essentially, we did in a weekend, 1,800 people from St. Luke University Hospital were trained on the bookings app to be able to set up virtual visits. The setup is actually quite easy. And so if you just go into Teams, into the bookings app, the first thing it'll do is ask you to set up a business. I've already have a business set up, so I'll just go into that business that I already have set up, but I'll walk you through the steps. It's simply identifying a business name. So this could be, like Ohio State University admissions. This could be, chemistry department, parent-teacher conferences, K-12, Columbus, Ohio, parent-teacher conferences. It could be, you just set up the name of the organization that you're going to be scheduling appointments on behalf of. And then not everyone needs to live in the bookings app. Only the admins who are scheduling are in the bookings app. Once you schedule it, what actually happens is that the meeting persists in your normal calendar. So if I'm a guidance counselor and an admin is receiving calls and setting up patient visits for me, or sorry, not patients, but parental visits for me with their students to discuss, I, as a guidance counselor, just live in my normal Outlook in my team's calendar, and the appointments just show up there. And the admin is just using the bookings app to schedule, especially if they have like 5 guidance counselors and they're trying to distribute load and look at, this one's focused more on higher ed, this one's more focused on technical colleges. And so they can kind of distribute that load and bring a bunch of people into one canvas so they can see everyone's availability and schedule. And again, with the bookings app, you can also make it available so that people can self-schedule, right? So you can post the guidance counselor schedule for all parents, and anyone can sign up based on availability. And as long as you've set up the service, so let me go into the settings real quick. So this is the business details. I just put a business name, and then I can set a different reply email alias than my normal name, and then a business phone. I can set up appointment types. I can have first counseling session, second counseling session, college preparatory session, grades and, career mentoring session, whatever the names of the different types of sessions are. Each one of those can have its own characteristic of different details, different websites they need to access, different types of reminders that I set for it. And then you add the staff. You add all the staff members that are part of it. This looks up just O365 directory, so Exchange directory. So as long as they have an Exchange mail, they'll be able to be found here. And then once you add the staff, then you can look flexibly at the staff and find availability and schedule appointments. When you schedule an appointment, all you're doing is adding. It won't say patients in your case. This is specifically chosen as a healthcare organization. When you set it up, it'll let you choose what type of organization, and then you just enter the person's name, their email, their phone number, and send the invite out. And then you can add multiple staff here. You can also CC like a student and their parents if you want. So it's a super simple, flexible way to be able to create those virtual connections. Anything you used to do in person could now be done virtually, leveraging this.
And so, Srini, great. That's super helpful. How do you manage? Let's say that we are doing transcription or we are recording video. How have you managed that then in terms of just the bulk of the stuff that's coming in? If you're doing 4,000 visits a week, at Stony Brook, how are those things being managed in terms of indexing that content and so forth?
In healthcare, largely people have wanted to not record the entire conversation. Okay. And so most of the healthcare users are not recording and not doing transcription. However, many are leveraging closed captioning because it's always nice to be able to see the words that are spoken for those that might have different, second language and first language preferences. So the closed captioning has been widely used, but recording and transcription has not been widely used. There is a time coming when they want to be able to transcript and push that directly into the medical record, but we're still a little ways off from truly wanting to do that.
So I'm thinking if we're doing advisement, let's say in whatever our student information system is, and we're using Teams virtual visits with bookings, and we recommend, Srini, you need to take, Anatomy 301, you're a pre-med student, whatever kind of things that we've discussed. Are we recording that inside of the meeting? Are we recording that inside? Where have you been? So somebody's taking notes on these things, right? If we're doing advisement, partner is sent out, they have that bot. How have you been utilizing that functionality in your discussions, or how have the customers been using it?
In healthcare, all of that is documented always in the medical record specifically.
Yep.
So the essential view for healthcare is that they have the medical record up on the left-hand side and they have the visit video up on the right-hand side. So they do the Teams visit, but they're in the medical record doing it. Or they use like the Andor bot to be able to pull in the medical record insight for that patient in the chat of that meeting. But more often than not, they've been putting it side by side. So think the guidance counselor sitting in the guidance counselor system where they're entering the details in this conversation. And it might even be a CRM system where they're saying, I touched base with this student. I told them these things. We had this note. It was this date. So especially on the recruitment side, most of them use some kind of a CRM system to be able to track and manage all of the recruits. So they would live in their CRM system. They would just use the virtual visit as the conduit to facilitate the discussion.
Awesome.
They could also have a Power App in Teams that sits right here that allows them to be able to track the 3 things they need to track when they have a call. And they can very simply enter those 3 things, and in the background, that Power App goes and sends that off to their advisement system or their recruitment system so that they don't have to mess with that other interface. They could have a much more simplified role-tailored interface in a Power App.
So we've had a couple folks on from AtBot and a few others over. So again, Power Automate keeps coming up more and more, and so I think that you bring up a good point. We'll probably come back to that, and then there's a couple other questions, Srini. Just we can kind of run through these.
Sure.
We're about at 4:54. Any thoughts on integration with any of the smaller EMRs that are out there, Cerner, Point and Click, et cetera? Kind of what's been our approach to that integration? Is it the willing come forward and we publish an API, or that we need to have those PIS?
Well, there's been no shortage of our desire to want to integrate with them. It's actually their willingness to want to integrate with us. So Cerner has held us off for quite some time. Epic held us off for 1.5 years before they finally said we could do the scheduling integration. And that's where I think the real value of something like a Andor Health comes in, because they are in the Epic App Orchard. They can connect with Cerner. They're in Allscripts' Orchard. And so they can go ahead and flexibly be a bot in Teams that brings that medical record data directly in.
Awesome. No, that's great. Another question we had is the bot in the store now, or is this a custom app using Q&A Maker?
No, this bot is in the Teams App Store. It's actually called the Think Andor bot. Let me just pull that up. Where was I? But the bot doesn't have any functionality until you actually have a service capability signed up with the Andor system. So until you actually sign that up, you can't really do anything with it. But it is in the Teams marketplace. They are a Teams co-sell partner and an Azure co-sell partner. So I'm sure there are opportunities for us to build the same kind of partnership with someone who does guidance counseling stuff in EDU or recruitment in EDU, as an example.
Okay. Super helpful. Let's see a couple more. How are healthcare institutions managing the number of booking sites created by admins and users, naming mailboxes, number of site creations, etc.?
Yeah, the good news is that there are a lot of APIs that allow you to do all of the bookings, businesses, meetings, staff, services, creations at one time. So we have had a lot of people who do that, and we also have taken the APIs and then strung them into commandlets that you can run to be able to say, like in the UK, there's a dental health organization that wanted to set up 500 bookings businesses, and so they did that through a commandlet running the API.
And do we have a library out on GitHub or somewhere of some of the commandlets?
Yeah, the APIs are all completely accessible if you just go search for the bookings APIs. We do have some commandlets, some PowerShell commandlets that we've created that I can figure out how to get that over to people if they're interested.
Okay. Is there a limit in terms of the number of providers going up to beyond 30?
Yes, we've actually increased that limit to 40 already. And then as we build a more stable service, we're going to look to increase that more and more. Really, the problem is that when you get beyond 30 or 40, the rendering of 40 calendars takes time. And so, nor do people really have 1,000 people they're scheduling for. And if they do, then it's much better to think about leveraging some kind of a bot construct to go into multiple business. So if you're thinking like a call center has hundreds of people it might schedule for, hundreds of businesses. So then it might need more of an orchestrated way of being able to dole that out to people. But in most cases, an admin usually manages schedules, and there's usually some ratio of an admin per 30 people or 40 people. And usually we found that's a reasonable limit for people to work under.
Okay. And I guess the complexity kind of compounds, right? But if you have multiple units that are doing the scheduling, it would make sense, I guess, to kind of handle each of them as a separate calendar versus having one department with multiple bookings tools, I guess. Although I could see how that could exist, right? When the time you could still use rooms. I've seen some people think about it as in their old world they would have 4 counselors that would maybe handle eight virtual rooms where they're talking to somebody, a new person gets pulled into the next meeting. Maybe there's some prep discussion that goes on with a nurse practitioner or with a guidance counselor prior to them maybe speaking with a mental health professional. I see a lot of that taking place, right, as people are coming up with some of the different challenges moving forward. So maybe there's even a sense of what does that workflow look like from one virtual room to another virtual room. Maybe there's a lobby where there's somebody that's kind of doing a welcoming function. Okay, here are the things that we need to know from you. Can you please fill these things out, or we'll take that down before they get transitioned over to that counseling engagement or health engagement. Another question we had from, sorry, go ahead.
To that end, one of the things, this virtual rounding scenario is a good one for that, in the sense that we basically built a power app that allows you to be able to see all the rooms and be able to go pop into whichever one. So if you said, if you basically had like a meeting and you wanted to have guidance counselor come in first, then nurse to check in next, and then the mental health professional come in after that, you can orchestrate that flow, because again, we have the Open Teams Meetings API. You can create that canvas where there's a SharePoint site where people can see the different people that are logged into the different rooms, and then different people can pop in, and you can move phases to say, I've completed my thing, you go next in there. So super simple to do all of those things leveraging the Meetings API.
Okay, great. No, and is that, when you say you built a power app, do you have an example of that? You could just quickly or show us what that view might look like. Don't kill yourself over it. It's
all posted on GitHub.
Okay.
So there's this virtual rounding capability that we've turned on. There's a whole GitHub repo for it that has a power app that basically has this notion of the use case here is you have a nurse who has a nurse's station, and they want to be able to see all the rooms and each room has an iPad in it with a meeting, a constant meeting. So you just click into whichever room in order to be able to see, who's in that room and to have a conversation with them. And this could be the nurse, the doctor, the specialist, etc. Same concept. You could use this power app, and you could essentially do it where it's a fixed room for a person, and then different people pop into that room, and each one that pops in does their check mark. And this is essentially a SharePoint list. It's just in a in an adaptive card viewing capacity. But you could do all of that directly today.
Can you share that link in the chat pane, and we'll put it out in the community call channel as well? That particular app. That's cool. I haven't seen that yet, actually, Srini. So this stuff is
absolutely
pretty quickly. Any other cool things in the Skunk Works that you guys are working on that's worth showing with the team?
No, this is really, there's another set of things that are really coming around lists and SharePoint lists rendering in Teams in a really good fashion, which then allows you to do all kinds of things, right? Checklists, planning lists. So there's probably something we can do on that in follow up in a month or so when that's going to be more ready to come out. But yeah.
Perfect. No, this has been great.
Answers the question from earlier. We were just talking about that at the beginning.
We were.
Oh, you were?
You brought it right back back around. I think that was like the first question we had.
Yeah, the whole lists capability in Teams is going to be a really, really big thing.
That'll be great.
Yeah. Hey, I don't have a way to post that link in chat here because there's no chat function here.
Just
send it. I'll send it to you.
Yep, and I'll post it in the channel. And I'll also make sure you get that, Jose. So we're at the top half of the hour now, or the top half of the start of the next hour. Srini, this has been great. I really, always appreciate you jumping on. We had one, I guess maybe it was a statement, why call appointment types instead of services like in the bookings interface? I don't know if you have any big thoughts on that at all.
No, I honestly, I don't know why we chose that. We should just call it services because that's what they are. But no, I don't know why.
Well, the same people must have worked in Microsoft licensing because Azure makes everything even better now. All right, let me stop recording. Let me stop recording.
Thanks, everybody.
Thank you very much, Srini. All righty. So